So I'm really passionate about digital because I think it offers so much potential to everybody, and that's from staff to patients to the allied system. It's a massive enabler. It's not going to fix all the problems in the NHS in every ward, but it enables people to make contact with services easier. It enables the flow of information. It enables people to look after their own health better with things like informational apps, for example, so they can look after their own health and be empowered as patients. Digital can also break down barriers. Patients may not want to come and tell their pharmacist or their GP about something, but they'll put it in an email or an online consultation. So it breaks down those barriers and some of that embarrassment, which is a big problem in particularly UK general practice, and quite often why particularly cancers are often diagnosed late. So if you can break down barriers and get those contacts earlier, it makes a massive difference. So digital can fix nothing but enable everything. The Pioneers is about getting staff involved and pioneering the digital journeys, because they're the experts. I'm not the experts of how the practice works in Sunderland. The practice manager there or the receptionist there, any member of staff there is. They know their practice population, they know their staff, they know the local geography, and if we can get them engaged to fix local problems and think about local innovations, then actually they can pioneer it locally, and then we can see if that applies elsewhere. And if it doesn't apply elsewhere, brilliant, it's still fixed that problem in that one practice. But almost certainly it can be adapted to other things. It's having the enthusiasm to get involved and to, in many ways, ask the stupid question. Because generally they're not stupid questions. We just think they're stupid questions and we sit there and don't ask. But actually asking the daft question, asking well, why are we doing it that way? Anyone that wants to improve digital inclusion, if they can sit there at home and think, you know what, my gran who's 90 couldn't do this, get involved and tell us. So we can figure out how we can get your gran who's 90 to do it, because being 90 shouldn't exclude you. And actually having that expert knowledge of it being your gran makes you an expert in that situation. And it's those experts we need. The Digital Pioneer programs for anyone involved in primary care, whether that's general practice, pharmacy, dentistry, optometry, and from anyone, any age of their career, any just starting out, just coming up to nearing retirement, anyone that can offer experience and new thoughts. So I guess what we're asking is for people to get involved and want to get involved, and there's so many ways they can do that. They can engage with the Innovation Hub if they've had an idea of a way to improve a service, and the Innovation Hub will support them through that process. There's CPD and training that's on offer. There's a wealth of knowledge out there, and a lot of it sometimes, particularly in primary care, people feel siloed and are just on their own in the practice, and we want to be able to connect up practices. So reach out, whether it's help you need, whether it's help you want to offer, whether it's help with innovation, whether it's training you need, reach out and let us connect you with someone.